Hello, everyone. Thomas Weimbs. I'm here again from Santa Barbara Nutrients. I'm talking with Penny Figtree from Australia, and we just talked about in the part one version about Penny's approach to treating her patients with low carb ketogenic approach. And we wanted to chat a little bit about kidney disease as well, chronic kidney disease. So, because that's one of the main complications, of course, of diabetes, chronic kidney disease. And I'm sure Penny has had a patient or two or three or many that also had chronic kidney disease. And I wonder what your experience has been with low carb ketogenic diet with those folks with kidney disease.
Yes. Yes, it's a real interest of mine. I actually enjoy getting patients with kidney disease. I like to watch their renal function stabilize, if not improve. Yes, so that started before. So because again, my husband's a kidney surgeon, and he'll often send people to me to lose weight before they have their operations. So I get quite a lot of patients with chronic kidney disease. And I really enjoy looking after them because what I see is that their renal function either improves or gets better, their blood pressure improves, and of course their diabetes gets better. And it's because of seeing that and the kidney guy in Port Macquarie being initially upset and then being happy about it, that I've started collecting information about these patients. So I've got a case series of 18 patients that I wish I could get published, but I keep not getting it published. And that's 18 that I've kept record of, but I've got more and more all the time. And I've got one woman in particular actually two patients in particular, and she came from Sydney. So I love it when people come from Sydney, which is a big city. And in a big city, you've got 50 specialists, haven't you? She had a specialist for migraines, a specialist for her fatty liver, a specialist for her kidney, and a diabetes doctor. So she had diabetic kidney disease. And so she came to me and it was just so fun. She was a legend. So she went on the ketogenic diet. And initially she was quite hypotensive. She was on spironolactone and furosemide. And so that first week was a bit scary because she felt terrible and was hypotensive. Blood pressure dropped to 100. And as you know, the kidneys don't like hypotension. So we quickly, stopped spironolactone, stopped her furosemide, and got her through that keto flu period. You add in salt and water, which everyone thinks is scary when it's chronic kidney disease. So, that was 18 months ago. She was on insulin as well. I can't remember, 60 units. So she's off all her insulin. She has, off those 2 blood pressure pills and continued to do well. And she wants to lose weight. That's her goal. But for me, I just love watching her improve her health. So, and her endocrinologist is amazed because her HbA1c is like 5.6% and she's not on any diabetes medication and she was previously, on insulin. And her endocrinologist is happy, and her kidney doctor wrote and said, because her renal function went from say 43 around there to now 60, eGFR of 60. And the kidney doctor said, I've always been worried about the ketogenic diet, but now I'm more interested. She writes nice letters, the Sydney woman. And the endocrinologist also says, doing well, stay on the low carb diet. So they're not mean about it. But I often wonder, what are they doing? She still goes and sees them, and I'm going, why are you seeing them? Like, they don't do anything. They monitor. They sort of like to monitor people getting worse. Am I being mean? I'm going to go on the internet and everyone's going to hate me.
No, well, I think that's actually, very realistic. The typical chronic kidney disease patient is, just relentlessly progresses, right? So they don't spontaneously suddenly get better. There's no medication that actually turns things around and causes remission. If the only medication out there maybe slows the decline, but it doesn't actually reverse anything. I'm actually writing a review article right now on the role of ketogenic diet in chronic kidney disease. And there's probably not a one slam dunk study out there that has everything covered and, thousands of patients, of course. But there's plenty of smaller studies, and they all are saying the same thing, right? So patients don't get worse on a low carb ketogenic diet. If anything, they're stable or they get better. And getting better is unheard of in kidney disease. Getting better is not the default. That's not the expectation. Getting better is kind of almost like a revolutionary eyebrow-raising type of event. So yeah, and you're seeing the same thing, right? So your patients actually get better.
Yeah.
So
I
the
had another
kidney
lady, her
disease,
EGFR was 29, now it's 40 something. So yeah,
right?
it's
Yeah, that's
interesting. I
amazing.
told a kidney professor this, and he went, "Oh, it's the weight loss. You know how they go, it's loss of lean muscle mass and their creatinine's lower. You know how they like to find excuses."
Sure.
And
Yeah,
I, and
yeah,
I
yeah.
said to him, "Oh, okay. So the GLP-1 agonists, they say they're good for renal function, but in none of those studies did they look at lean muscle mass loss as an effect for why but when it's a diet, they look for why it isn't
Mm,
real. And when it's a drug, they go, wow, that's amazing. But no one looked at
right.
lean muscle in the loss of those. But anyway, um, yeah, look, it is. And I just see it all the time. And it's just
Mhm.
amazing. And Karen Dwyer, who's a professor in Australia who you've met, and
Mhm.
she is the clinical director of Kidney Health Australia. So she's very involved. And she said it's her happy place. So low carb medicine makes her happy.
Mhm.
Other medicine, she said, it's like moving the deck chairs on the Titanic is what
Mm.
normal medicine is.
Right.
That particular patient that I talked about who
Right.
has all the Sydney specialists, they all
Mm.
order so many blood tests. So I get
Mm.
copies of them, and they're like 2 days apart, all ordering the same things, different doctors,
Mm.
and no change in management, just ordering tests all the time. It must
Mm.
cost a fortune. I actually said to the patient, "Are you sure? Maybe just go, don't, why you tell your doctors I've already got that, because it's ridiculous." She had renal function assessed one on 2 separate days just next to each other. So
Mm.
unfortunately that's what modern medicine is at the moment. But
Mm.
that's
Yeah.
exciting that you're doing a review.
Yeah, well, let's see how it will be received. We'll find out.
Yeah.
Yeah, but I think it's, I think just like for so many other metabolic diseases, I think there's going to be a breakthrough sooner or later in kidney disease as well.
Mm.
And um, I think the truth will come out, and people will realize that there's probably no pharmacological intervention that comes close to what these dietary interventions can do.
Yeah.
So that's going to be out. And another sort of a related topic is, and you and I have been talking about uric acid quite a bit. That's something that's perhaps a little bit understudied also, and maybe understood um, in chronic kidney disease. But one interesting tidbit of fact is that people with gout, so very high uric acid levels, they have an incredibly high risk of developing chronic kidney disease, something like 80 to 90% or so. And we have done some research, in my lab on animal studies with uric acid, and found that it is very potent in worsening chronic kidney disease and in polycystic kidney disease. So you and I have been talking about uric acid, and that's maybe the one thing that sometimes pops up as an adverse effect of ketogenic diet, is sort of the increase in kidney stone risk. And it turns out that the kidney stones that do come up in the literature with ketogenic diets tend to be uric acid kidney stones. So there's an elevated risk of that. So since we have been talking, I think you have been sort of like maybe starting to pay also more attention to uric acid in your patients. I don't know if you already have any insights so far. It's been pretty recent, or
Yeah.
if you have seen any trends going this way or that way in your patients.
Yeah, so yeah, I'm much more interested in it, absolutely. And I do think you're right. That's the one thing with chronic kidney disease you've really got to watch. Um, I had a so I haven't so I'm always measuring uric acid now, as I didn't before. And I haven't seen it go up a lot yet in people, but except for one lady who, with bipolar disorder, but she came for her metabolic health, and her renal function dropped. So she had normal renal function, and I put her on a low carb diet, and she had high uric acid, and her renal function dropped on the diet. So 1 week in, her renal, whenever I did it, I can't remember, maybe a month, her EGFR was 59, not a lot, but, it was normal, and then 59. And her uric acid, it might have gone up, I can't remember, but I knew she had high uric acid at baseline. So I put her on sodium bicarbonate because I didn't have your keto citra then. So I gave her sodium bicarbonate, and it dropped. The uric acid then dropped when I measured it the next time.
Right.
And her renal function went up a bit, but Karen Dwyer said, oh, that's just lab error. It could just be lab error. But I'm about to do it again to see what it is. But I would never have thought until I met you, oh, it could be the uric acid going up on the keto diet and damaging the tubules. So I'm very much into measuring it now and seeing, and I do think that's the big thing. If you've got chronic kidney disease, you maybe keep that urine alkaline, which I never understood, to improve, the uric acid and stop it. Keep the urine alkaline so you don't get the crystals in the urine. But yes, a whole new little twist to make other doctors go, oh, don't go on a ketogenic diet. You know how they like to find reasons not to?
Oh, yeah, right. But there's something you can actually do about it, and
Yes.
it's actually pretty easy, yeah. And
Yes.
that's one of the secret sauces, if you will, in keto citra is actually the urine alkalinizing effect, which kind of antagonizes the problem of uric acid, clogging up the kidneys and damaging the kidneys.
Yes, I've
And
given
of
that
course,
lady a pot now. She's got a pot, so we haven't done another test, but she's on keto
right.
citra now. Yeah.
Perfect, yeah. And of course, you and I and Karen Dwyer have been talking about a clinical study on looking into this. What is the rise in uric acid when somebody transitions into a ketogenic diet, and how does something like keto citra brings us back to normal levels. So I'm really excited about working with you guys on trying to pull this off and put like a nice study together, because I think there's just so little good information out there. It's really understudied. But I really think uric acid is incredibly important. We've been talking also about sort of indigenous populations, in Australia, where they have very high rates of chronic kidney disease, and they live in very hot environment. There's probably a lot of dehydration going on. There's already a link to uric acid being involved there. So I think there's some exciting work that can be done with relatively simple measures, to avoid all this.
Yeah, it's amazing. There's so much science to be done, isn't there? We're just at this, we're all excited, but we don't quite understand what's going on. And that's what Marcus Seaman was saying, wasn't he? Like, we don't understand. Like, we know you lose sodium when you go on this diet, but we don't quite know why. There's just all this science. And that's right. And uric acid, it's simple, it's, easily measured, and it's probably very important. Again, also for fatty liver disease. It's important for that as well. And nobody's looked at it in this way. So it's sort of fun, isn't it?
It absolutely is fun. I mean, it's almost a good thing, that there's so little information out there, because there's room for things to do. So
Yeah, that's we're not
get
just
bored.
repeating someone else's study.
Exactly right.
Yeah. And so for
Yeah.
patients who can't get keto citra, would you just do sodium bicarbonate? Do you think that's a reasonable thing to be doing?
It definitely is better than not doing anything, I would say. The one, a few things about keto citra is it also raises the urine citrate levels, which also actually tend to get way too low if the urine pH drops down, which is what happens on a ketogenic diet. So the keto citra has a citrate already built in there, and it also, of course, has the beta-hydroxybutyrate, which is kind of the magic ingredient, that is this highly anti-inflammatory compound. And of course, inflammation in chronic kidney disease is extremely important in driving the progression of the disease. So um, I always think, why not use the best package?
Yes,
I think bicarbonate addresses one thing, but something like ketosidra actually addresses a whole
everything.
range of things. So
Yes, I was just
um,
thinking for, my people that are, it's hard in Australia, it's to get it. So for those sort of new patients that I see, that's sort of
mhm,
my trick. But that's right,
right.
keto citra's got the electrolytes, the citrate, the ketone salts that everybody pays millions of dollars for. They're very
Mhm,
popular, aren't they, those salts? So
yeah,
yes,
but
no, I've
it
got
should
some
be.
pots now in my cupboard.
Mhm, yeah, but definitely let me know if your patients have any trouble getting ketosidra, because it shouldn't be difficult.
Okay.
They can just order it, and it ships for personal use worldwide, including Australia.
Yeah.
So I'm happy to help out if somebody is stuck somewhere. So
Okay.
we'll
Thank you.
definitely make that
Thanks,
happen.
Thomas.
Yeah, and I'm really looking forward to working on a clinical study with you and your colleagues in Australia. So I'm really excited about that. And we've had many meetings already, and we'll have more. So looking forward to getting
Yes, me
some
too.
results.
Yes, really interesting.
Yeah, all right, great. Well, Penny, thank you so much for your time. I really appreciate it. Great, we'll be in touch soon,
Lovely.
and
Thank you. Keep
have
up
a
the good
great.
work. I look forward to your
Thanks.
review very much.
Wonderful. Great.
Okay.
Thank you,
Thanks, Thomas.
Penny. All right. Bye.
Bye.